can't emphasize enough how useful it might be to actually practice letting yourself have an unconscious symbol for having completed the work you're doing. Okay, so let's pick another topic. As far as we've covered that pretty well. We covered a lot of structure to functional interface with that. And that's how I like to teach these days. I really like to pick a live model or the simulation thereof, and then just go through it and learn what we can learn. Similar patterns occur very much so with differentiating between heart and chest problems. I've got this. I've said it many times. I think I've got a fifth, sixth, or fourth, fifth. I think it's fifth, sixth interface on the left side that sometimes gives me pain, and that pain can be sharp, but occasionally it can be dull, particularly if it goes across here. Now it's interesting. Angina used to be called, and I guess in some cases still is, used to be called angina pectoris. So to me, that makes me think about the close connection between the heart and the pectoralis muscle. Now, in applied kinesiology, this test here is for the pectoralis sternal, and this is for the pectoralis clavicular. My clavicular is strong. Haven't eaten anything in, I think, 25 days. Well, peanut butter with celery. And then, but my sternal blows out. That would be liver. Okay, so there's an interesting thing right there. You could have a weakness in the arm. You could have a weakness here. This test particularly towards the midline, and you push out and down. Tests this muscle, pectoralis. So that's also how Dr. Carl Ferrari, talking about that structural functional interface, got into the endocrine system. He would test that way. But Dr. Goodhart talked about, Dr. George Goodhart, the chiropractor who developed the ideas behind applied kinesiology that most people adapted, i.e., quote, stole in the kill box. Pectoralis sternal, he related to the liver, particularly the right side. Look, here's pectoralis muscle, here's the liver right here. Liver reflex, by the way, in TBM, it's like this right side, okay? But there's also a neurolymphatic reflex here, which, by the way, feels good for me to do. I'm going to do that for a moment. That's my right side. That's the liver. Right underneath the breast, there's this, you rub in the rib interfaces until they're not tender anymore. Okay? So let's see, let's go back and recheck that. I think I was checking myself. Yeah, see, that's stronger. So now my attention is actually on the liver. So people will tell you all the time, I've got liver problems. How do I know? Or gallbladder. My liver, my gallbladder, my pancreas. I'll hear this all the time. Okay, fine. How do you know it's your liver? That's the first thing you ask them. Have you had tests? Well, no, I had this muscle test. Well, that's not evidence really, depending on how good you are at it, I suppose, but not even, I'm really good at it, and I wouldn't say that's evidence. But what you could say, have you had liver function tests? Yeah, we had liver function tests, and no, I don't have any elevations in my liver enzymes. What about hepatitis? Have you ever had hepatitis A, B, or C? I say, no, not that I know of. Okay? So you could, what you could do, you could go to the vaccine master module, and you could tap that in relation to liver. Oh, look, I do get a response. Now, is that on me? No, it's not. Okay, good. That's on some female. All right. So I do get a response. Now I've got vaccines affecting the liver. All right. So this is where it gets interesting. How old are you? Now remember, we're still in the pectoralis. We're still in the endocrine system. Okay. How old are you? I'm 35. Okay. That's the answer right here. Okay. 35. Ever been pregnant? 3 times. 2 abortions, 1 miscarriage. Okay. So that's what you've got. You've got 2 abortions, 1 miscarriage. All right. Miscarriage was when? That was 5 years ago. Okay, so when you were 30. So when was your first abortion? 16. When was your second one? 18. All right. So those are points. Those are nodes of reference. Okay, so you go abortion. I'd go down to the pelvis probably. Abortion 16, not showing. Okay. Abortion 18. Oh, look, there's a problem. Okay, tap that in. Scan in relation to function, structure. Okay. So we started with the liver, started with the vaccines, but that took us to our questions. Our questions took us here. Okay, and we haven't forgotten the vaccines, but let's put the vaccine module, we've already got it in the circuit. Let's check to see where the vaccines are. Pituitary, thyroid, thymus, oh my goodness, liver, ovaries, uterus. So history of endometriosis, painful periods. Yes, painful period all the time, worse on the right side. Um, I almost thought that I had a pregnancy there one time. Okay, so you check. I'm not checking pregnancy. All right, check the ligaments. Go to the ligaments. Not showing. Go to the muscles. Showing. Go to the uterus. Now we're talking about the muscle of the uterus. Now that's still structural, isn't it? Okay, so we're going to tap that in. How many patterns here? We're going to clear the dyslexic patterns. Scan in relation to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 patterns. Tap that in, run the eye positions. Down to the right, up to the left, down to the left, up to the right, tap back to front. Go to the uterus. I want to move the uterus. Why? Because I can feel it doesn't move on the right side, but does move on the left. Which way does it want to go? It wants to go down and to the left. So down to the right with your eyes. Hold that until it moves maximum. You'll feel it kind of, you may feel scar tissue breaking because there's probably scar tissue from the abortions. Down to the right. Okay, up to the left. That pulls me down into the scar tissue. I can feel it now. So I want to pull it and just pull until you feel it stretch. It may pop. Okay? Down to the left. Down to the left, to the left, down to the left. Yeah. Then go straight up and to the left, towards the left. ASIS. It's left hip here. That's moving a lot. There goes some more scar tissue tearing. Little bits there. And you don't, I'm not pressing hard. I wouldn't have to press hard if this were an actual person, which it is probably, because that's the way things tend to roll. Okay, and then up to the right, it wants to go back to midline. Tap back to front. Okay, now we'll go check. Okay, so the structure is still showing up. Let's tap that in. Now it goes to the thyroid. Why? I went to structure first, tap. It's not showing here. I did this fast, sorry. Segment 1, segment 2, I'm on the thyroid. Thyroid cartilage, I'm going to point to the cartilage. Yes. Thyroid cartilage can be offline, it can be out of alignment. It can move to the right or the left. Mine is currently actually, well, it's not terrible, but it's actually jammed on the right side. I'm going to have to fix that before I teach so I don't go hoarse or something. But here, let's feel this. It moves, press on it. It moves to the left. I'm sorry, to the right. It will not move to the left. So it's stuck on the right side. It moves to the side it's already stuck on. All right. Now I might use the bullet here because I could. And I'll just focus on moving here. I'll focus on moving that thyroid cartilage back to midline.